Hi, I'm Dennis C. Miller, host of my podcast, Visionary Leaders. Welcome. For those of you that are not familiar with me, I'm an author, keynote speaker, and chair and CEO of the DCM Center for Nonprofit Governance and Leadership. And today, I'm very, very happy to have a phenomenal person who's a very successful CEO in the mental health field and consulting. And I want to have her introduce herself right now. So, Verena, say hello. Welcome aboard.
Hello. Oh, Dennis, hi. Thank you so much. It's wonderful to be here. I'm Verena Blyle, CEO of Maple Counseling. Maple's been around since 1972. We are one of the larger providers of affordable mental health care to those most in need. And at the same time, we're training the next generation of therapists in the Los Angeles area. But because of telehealth, we can serve anybody throughout all of California.
I would take it the demand for mental health services is pretty high right now.
Yes, it has been pretty consistently the past few years since the pandemic, for sure.
Yeah. You've been the CEO now 5 years. You that's a great, looking back, what are you most proud of? Is there an achievement that you feel that just you really makes you smile so much because you're so happy about the success you've had? Is there something you think about?
Yeah, thanks for asking. Um, there's a lot that's been achieved in this amount of time. We had our 50th anniversary, moved into a new clinic. We've rolled out this whole new strategic plan that's just finishing at the end of this year. Um, but I honestly, what I'm feeling right now, and I know it's the holiday season, but I am feeling so immensely rewarded and fulfilled by, I think, what is most leaders' dreams, which is I started Maple Counseling in 2021, deep pandemic. It was January. And in fact, I was interviewed completely over Zoom. Hadn't even met a single board member in person when I started, and none of the staff either. And when I walked in, it was a combination of just kind of where the organization was and the pandemic. There was just this real fracture, like disconnectedness, lack of community. It felt sad, honestly. And the board felt so tired with their incredibly dedicated and committed banging on doors and asking for Maple to exist one more year, please. And so I came in and I got to experience a cultural turnaround. And I've done turnarounds before that made the organization more successful financially, that brought in great support tiers and expanded our community. But I don't think I've ever experienced a turnaround that happened both on staff and at the board level where there's such a sense of pride, connection, like value and mission aligned connections. And that is not all me as a leader. That took a little bit of luck, a lot of strategy, the right people. But I just feel very fortunate now. Like when I come to work, it truly feels like family on all levels, from board to staff to volunteers. And that's a great feeling.
Well, but it's kudos to you because that really, having everybody becomes what you call strategically aligned and have everybody feel part of a bigger picture, bigger organization, feel part of something is a key aspect of leadership. And you did that. That's very important. And have everybody feel like they're just on their own and left on their own and no one cares. You make people feel like they care, like you care.
Yeah, well, we do. And
Yeah.
and and it started with, our mission of supporting the well-being of anybody that calls us or walks through our doors and
Yeah.
making sure that we did that for each other. So, yeah.
So what lies ahead for you? What are the things I want to talk about more about, how you achieved that alignment and your strategic plan? Let me ask you, what were some of the goals that you had to achieve in your strategic plan? What are some of the goals that you set out for yourself to achieve? What are some of the goals that you set out for yourself?
Thanks. Yeah, sustainability is always in every strategic plan I do.
Sure.
So We went from a $1.7 million organization when I started January 2021 to what is now passing tonight. Actually, our last board meeting of the year is just slightly over $4 million budget. So that's a pretty good expansion
Yeah,
over, let's say, 5 years. Um, but it was done because of being very strategic about program expansion and how we respond to community trauma and crisis.
yeah,
Really looking at what the needs are and making sure that we're ready. And so we have a lot of new programs that are related to supporting the community that was impacted by the LA fires last January, almost a
can you
year
imagine?
ago.
Can't imagine.
Yeah, and then there's just a lot going on in the world. And the
Yeah,
news is hitting youth at much younger age than my generation. They have access to images and information that we just didn't grow up with. So there's a crisis for adolescents nationally across the board, and then also just adults. We're all very overwhelmed. Um,
yeah,
our inboxes are full, the news is full. And so managing anxiety and depression as just generalized in the community and making sure that we're not just sitting around waiting for people to call us for therapy, of which we get, but also
right,
actively, proactively going out into the community and meeting people where they are and holding their hand a bit more. We created this program called the Brisk and Wilder Welcome Center, which I am extremely proud of. I was fortunate to be the one that got to launch it a year after I started. These incredible philanthropists, Rex Wilder and Judy Briskin, came in, a mother and son duo that had personally experienced a mental health crisis in their family, and they just felt they had all the means in the world to get anyone on the phone, pay for any program, and they were lost. You can get really lost in LA County and in general, just even knowing what it is you or your loved one needs. Step
right,
one. Step
right,
two, finding a place that has an availability, not a wait list if it's a media crisis, et cetera, et cetera. So they created the Welcome Center so that for free, anybody can call Maple Counseling. And we have licensed people that assess what the need is, and then they connect you with services. If Maple Counseling isn't right, we don't say, sorry, good luck out there, and maybe send you with a referral here and there. We actually do case management because of the Welcome Center. And we work with people's insurance, or if they don't have any insurance, we work within the budget and the needs, and we use experts to figure out what it is they need. Is there a modality of therapy that would be more effective for what their symptoms are, et cetera? So a lot of people just feel so overwhelmed and alone in this process. Like, I have to call around and leave messages for 10 therapists on my insurance plan, and almost no one is available. Either their message says it or they never call me back. We actually absorb all of that. The whole idea behind Maple is to reduce all of the barriers to nothing. So all someone has to do is pick up a phone and call us if they need mental health support for themselves or a loved one. And so there's been a lot of proactivity, is what I would say, that I'm really proud of not sitting around and waiting for them to call us, but recognizing the need is in the community. And when it comes to mental health, not everybody can pick up that phone on their own.
right.
Sometimes they need support for that.
Yeah, that's incredible that you have this sort of welcome center. Couple of things here. You obviously changed the attitude or the feeling about your leadership team. What was it? What was it about what you did that you think brought them together, gave them a sort of that spark, that sense that we're stronger together than we are by ourselves? What did you do to inspire that to them, you think?
Oh, that's a great question. Oh my gosh, there's so many answers to that. I mean, they always say it starts from the top, and then immediately I get anxiety for all the days that I'm like overstressed or upset. But we're all human. But I am very aware it starts from the top. So I start my day with meditation, and I'm very intentional. And so I actually visualize the feeling of being surrounded by a team that cares for one another and is
Yeah,
stellar
yeah,
and really, really loves their job.
Okay.
because nonprofits just can't compete with for-profits in so many, financial ways. But
Sure. Right.
that we can do. We can give people meaning and purpose. And there's a Harvard research study that I learned when I did my master's, which was they showed that money actually doesn't motivate people to perform better. That the thing that motivates people the most is meaning and purpose. And so I've done things in the past where like I'm always talking about the mission. They say always refer back to the mission, read the mission at staff meetings. And I'm not sure that that's as effective, even though they say it's best practice and I do it. But what really helped, honestly, and turned things around was I hired somebody who loves building cultural connections and caring amongst staff as my CFOO. She's got
Right.
this infectious laugh. She created this employer of choice plan with me. And
Right.
and the thing is, I always cared, but I was always pulled hither and thither, especially if I was running as like the primary fundraiser for a time I was. I
Right.
actually wrote all the grants to have someone as a thought partner with me that cared as much as I did and then did a lot of the implementing and research. And one of the things that sealed the deal, and I was really surprised by this, and it took them about a year of convincing me of this, and I piloted it in various ways for a year, was a 32-hour work week. And I thought this was crazy. I thought, okay, almost everybody in nonprofits, but specifically at Maple, is doing like two, three jobs each, right? We were not staffed to do the workload like a Google can do. So I thought, how are they going to do this job in 32 hours? And the research all showed that actually performance increases. You can hire better candidates. That many times people will take a job that gives them that 3-day run of personal time a week
Yeah.
over more salary. And so after piloting it for a year in various forms, we implemented in March. And I have to say, of this year, and it's true, I just saw the joy people come to work. It's infectious. They're so grateful. The productivity did not go down. In many cases, it went up. And it just helped a lot. That's just we did stuff on the board, but the staff, there was a lot of just like a small shifts. And then that I would say was like a major shift for us.
And I could see that. I mean, I could see clearly how an employee could feel um, cared for. They had some free time, weren't stressed out a bit. So when they came to work, they could really focus on it. That was a smart move, the 32-hour work week. That was very smart. Very good.
Oh,
Excellent.
oh, thank you. Well, we were having a hard time hiring and retaining very top tier talent.
Right.
LA is a very crowded market, and there's
Right.
a lot of demand for licensed clinicians in LA.
I'm
So
sure.
it was just highly competitive. And then there's a lot of concerns, which I would say are unjustified because our clinic looks and feels more like a spa. It's not, we're not dealing with high tier trauma, but there was concern for administrative staff hiring of, working at a mental health clinic. There's some assumptions I think that we often have to combat. And so that helped us too. It just, really recruiting top tier. It was a game changer.
What was a big change you probably had to make for the board? And general, was there, I mean, what did you do to help kind of create the same kind of a relationship with the board to get energized and get them, all together with you? Anything come to mind at all about some of the changes you had to make?
Well, yeah, a few. I did an assessment when I came on, and I think some of them felt sad that Maple had been around for over 50 years, but not a lot of people knew about it. If they ever said to them, I serve on the board of directors of Maple Counseling, a lot of people said, "What? Where is it?"
Yeah,
And
that's
it's
good. That's good.
highly regarded and very well known within the mental health field in LA. But outside of that, you may or may not have heard of it. And so they had mentioned, like, I really wish that Maple was more well known. We're sort of
Yeah,
the diamond in the rough of LA, right?
sure.
The secret gem, as they say. But so I actually did invest in some press. which was good. We don't necessarily need clients, as you mentioned at the beginning. Like, there's a demand and we're just trying to meet it. But um, and that's what our strategic plan all states is like try to meet the demand for our services by expanding strategically. But um, so we never really needed to invest in marketing. We're word of mouth, and most people want word of mouth for when they're getting a referral from mental health services. An advertisement only goes so far for something so personal. So it just wasn't a line item for us. So it really was something I had to think through about the investment financially for us. The board wanted this, and I was trying to figure out how to get the word out in a strategic way. And there are two things we did. We hired someone who's an outreach senior manager, who just hits the pavement, making sure that communities know about our services that could need it and getting the word out at large. And we also hired a PR person to get me out more on the news, and it coincided with just whenever there's high anxiety. For us, that was the LA fires that came right on top of the immigration raids in LA. So we had a bit of a double whammy, and our community was really reeling. So it was, I don't like advertising just for advertising's sake. So it was a very heartfelt way of getting out the message. We put together a strategic, um, you know, 2-minute process for calming your nervous system in times of chaos and anxiety, and just got the word out on news channels that of course brought awareness to Maple. And so long story short, I think increasing pride in any way you can, like, oh, I serve on this board, that that helped. We've expanded in really beautiful ways to service the community since I've been here, and making sure they knew about it. I have someone come at every board meeting just to talk about elements of that are happening programmatically for us, so they're not always just in the weeds with approving an org budget or an audit, or what are the committee check-ins. Just making sure that they feel pride in their incredible decision to be of service to their community in this way.
Mm. I have this saying that's called the 50% rule. I don't know if you ever use it, but at board meetings, you ever talk about, besides their finance report and this report and that report, or committee report, you ever just sit down with your board chair and have a discussion with everybody to talk about, the impact you're having and the value you're bringing to the community? You ever have those kind of discussions? Like,
Oh, no, but I love that idea. We're always sort of chock a block. So I love that idea, Dennis, and I want to do it.
I had this long time. So I've been in the business for nonprofits for 20 years, serving nonprofits. And, before that, I spent 25 years in the healthcare world. I was a CEO, president of 2 medical centers, and a corporate executive between. And
Mm.
so I had this client literally 15 years ago about, it was a residential treatment facility for boys and young men. And I remember the board chair said to me, I'll never forget this. He said to me, I just don't seem to be able to engage my board members. And I'm like, okay, but that's sort of like telling your doctor you got a flu, you don't feel good, a little bit of cold, whatever. Okay. So I interviewed them all, and this was, way before pre-COVID. So some in person, some over the phone. And I never forgot this. I think there was 12 of them, and 4 board members told me, if I miss a meeting, I don't feel I miss anything. And I was like, what? They said, yeah, if I miss a meeting, I don't feel I miss anything. So I thought, geez, now I can see a little trouble. So I asked the board chair, could I go to a meeting, just observe it? And I went and observed it. And what happened was something like this. So the board chair called the meeting to order, approved the minutes of the last meeting, and their CEO read word for word the report that he sent out in an email. Not like, let me give you the 2 things that are different. And okay. Then the finance report was well done. The CFO was phenomenal. She was excellent. She was very good. There was an update about facilities because they were expanding some of their programming and buildings, and then maybe programming. And then there was a big thing about their gala because it was the 100th anniversary gala. About gala. And I'm just sitting around in the auditorium in this kind of a U-shaped table and listening. And then the board chair said, and he was a great guy. He said, is any questions? And there was no questions. And he said, okay, I'm going to call the meeting to order during the meeting, and we'll see you in 3 months. And I'm like, no wonder why no one feels they miss this meeting.
Right?
So here's what I tell people. So it's important to have committees. Absolutely want your committees to report, but I always have like, well, so have your board arrange pre on the agenda ahead of time, a question that you and the board chair, whatever the title is, will be asking, something like this. So today we're going to talk about how do we measure our success, and we're going to talk about and then how do we measure our own success as a board? How do we measure success? How do we measure success? And then something like this. Next board meeting, how do we measure the value we bring to the community? How do we measure that and get people engaged in that? And then another question might be, you know, what's our image in the community? What do people think of us? And have this. And then last but not least, always is, why are we worthy of a gift? And I find that when people get involved in those kind of conversations, which I find board members become more motivated, more engaged, and I think more productive. And last but not least, and I never forget this, this is so in my latter part of my healthcare career, I, became the executive vice president. Um, and 7 months later, they fired my boss, made me president, and he had no relationship with the board members. And I remember my first Christmas as president, and I lived an hour away. I invited all the board and spouses and everybody to my home for the holidays, not, and had it catered, bartenders, waitresses, and blah, blah, boom. And everybody just enjoyed being together. And then so that when they're at a finance meeting saying like, oh, Karina, it was great to meet you and your friend or your spouse, your husband, your girlfriend, your boyfriend. And before you know, people got to know each other. And I find it so important versus just, and I understood then why board members were not engaged. And I thought that's important. So I was curious here. So,
I couldn't agree with you more. Yeah, in fact, that's funny. Tonight we're having our last board meeting of this year, which is also our fiscal year, and we're having this volunteer appreciation event afterwards, which is for all our volunteers, but obviously board too, because we also realized the importance of that. And it used to be more of a stiff getting awards volunteer event that didn't include the board, and then we just made it festive because, like you said, not to underestimate how great it is for these amazing people to meet one another. I mean, they are all incredible people. And when you're sitting around in a board meeting, it's very important work, but you don't actually get a lot of opportunity to meet and talk. So you're right. It's so important to build that community.
well, you obviously have done a fabulous job at Maple Consulting. You've took over an organization that was, I won't say sleep, but kind of on the quiet side with a big demand. And you were able to instill a lot of positiveness with a 32-hour work week, leadership team development. You brought some really good people in. You talked to the board about the commitment that you were seeking as partners, not just, all in favor say aye. And so now you've got 5 years behind you and many years ahead of you. Do you have any hopes or dreams going forward about the next year or two? What you want to add on, or anything that you think about, or just be content where things are?
Oh, no, I don't think you're ever really allowed to be content, which I've thought about. I'm like, why not? But I think maybe there's organizations that should just be content, but when it comes to mental health in 2025, it feels a little bit like that fire hose going off and you're trying to put the lid back on. The needs are so great and truly lives are on the line. So complacency just, I don't think any of us understand that because our biggest challenge is to sort of take calming breaths. Um, but so I will always say that our my vision is to meet the need. I sort of drive people crazy when I make that statement of like, gosh, my real vision is they don't need maple counseling. People don't need therapy. They don't need life-saving interventions or even just an expert to guide you through feeling less anxious or depressed. I wish they taught compassion. We have a program that does teach compassion in elementary school, as well as other, social emotional learning skill sets like conflict resolution, even understanding your emotions. But if that was a program that was in every elementary school, I think you'd need less of Maple's programs on the other end. So I guess it feels like in my lifetime, and I don't mean to be negative, but I feel like we will always have a vision of trying to meet the need and to make people feel peace at heart and who they are in their bodies and their humanness, and spreading more goodwill from an authentic, genuine place that comes from the comfort within.
Well, I thank you for being my guest. Clearly, you are a visionary leader. You were very impressive. How can people support you? How can they reach out to you? How can they get to know the organization or get to know you? What's your website? What's your website?
Thank you, Dennis. So we have one of those funny websites called the number 4 counseling.org. So maple4counseling.org. So you can always find all kinds of information about us there, obviously. But if someone want to reach out to me personally, I'm happy to give my email, which is the first initial of my first name and then my last name. So VBLEIL at tmcc.org, or just info@tmcc.org if that's easier. But yeah, I welcome anyone that might want to learn more about Maple Counseling, all of our services. Just reach out.
Well, you have so much to be proud of. You've done so great for the residents and community of Los Angeles. It's my pleasure to have you here. And then just want to thank you very much, and I appreciate
Well,
that.
thank you, Dennis. It's an honor to be on your podcast. Thank you.
I want to thank everybody, all of our listeners today. Again, I'm Dennis C. Miller, author, speaker, coach, consultant, and working with boards and CEOs and help them build stronger, more successful organizations. And again, our website is denniscmiller.com, and my email is dennis@denniscmiller.com. And look forward to talking to you all here, and have a great day. Thanks a lot, Rain. Appreciate it. Thank you.
Thank you, Dennis.